I'm Dr Toby Coates. I'm the Director of the Kidney, Pancreas and Islet Transplant Program at the Royal Adelaide Hospital and a Professor of Medicine at the University of Adelaide, and I'm involved in a lot of teaching and research as well as clinical care here at the Royal Adelaide. One of the things that immediately comes to mind, of course, are the fact that we throw away paper gowns every time we go in and out of a room. The wastage there is astonishing. I'm also always very concerned when drugs are thrown away because of use-by dates, and I'm never really sure how long drugs remain useful. I certainly know that in our lab we've been able to take discarded clinical stock and use it for 20 years after the use-by date. Organs that we're not able to use is something that concerns me greatly. We have a large number of organ donors and not every organ is usable. Unfortunately, things, for example, like the pancreas aren't usable sometimes. And that's a waste as well. So we clearly need better ways to resuscitate organs so that we can get better use and better usage out of them. Oh yes, one of the other great wastes that annoys me is that once medicines have been dispensed, they can't be sent back. If they've used half a packet, you can't reuse the rest of them. And I understand why that is the case, but it's illogical. It really is. And it's not. If it was within your own family, of course, you know, if you were paying for it, you'd reuse those things. To be honest, I think it would be nice to have gowns that could be washed and recycled, and I think that would be a very positive initiative on a similar sort of level. You know, I think in theatre now, instruments are frequently thrown away after a single use because of the costs of re-sterilising them. That's absurd in 2022 that we should be doing that. We should actually be cleaning and recycling and not just creating more. That's extraordinary. An interesting example of this sort of comes from the past. When I was starting off in dialysis back in the 1990s, the patients who were on dialysis, we reused their dialyzers. They were taken out and one dialyzer would last for a week or seven treatments, and they were sterilised and reused again. That's completely stopped now, and every dialyzer we use is single-use, disposable, throwaway. That's a terrible waste as well. Medicines that are expensive medicines that are going to be thrown away could very easily be used in the lab to do testing. I think particularly when you're drawing up expensive drugs like rituximab or antithymocyte globulin or any of these things, where you're doing a dose and there's always a little bit left in the bottom of the vial, we'd love to use that. That would be very helpful and very, very practical for us. We reuse central lines for some of our work that we do in the lab. We reuse any instrument that can potentially be recovered. In terms of in the hospital, I was aware of one pilot program down in ICU where they were looking at reusing gowns and rewashing them, which I thought was good. From our point of view, we will always recycle any instruments that they're going to throw away from theatre. We'll take out to the lab and use them in the lab. So we have a steriliser out there, steam steriliser. We can sterilise things, and we can reuse them. So we try as much as we can. And obviously, transplantation is the ultimate in terms of recycling. We recycle everything that we absolutely possibly can to do our research. I mean, I guess something that has been good has been the electronic medical record, because of course it reduces the amount of paper we used. But paradoxically, we're still receiving paper results. We can't get results from external providers electronically. They have to come in paper-wise, and that's ridiculous. And that's to do with the fact that the government won't let external providers have access through into the electronic medical record. because of risk of privacy, etc., etc. So I understand why it has to happen, but it is still a bit, you'd think in this day and age we'd be able to do something like that and make it a bit better. One of the really great initiatives I've noticed on the ward is with the masks. And one of the great things is the nurses, because these masks are rather tight, there are special extension pieces that you can get. So we've been actually saving these plastic ones when they come off and reusing these other ones, so little boxes of built up plastic bits. And that's a very practical thing. I guess the cloth masks are good, but they're not as efficient at keeping out viruses as the N95s are. So those, I guess, are practical things that the nurses have put forward, which I thought were really good. War on healthcare waste.